Question 1. Which of the following massage techniques involves rhythmic lifting, squeezing, and kneading of the soft tissues? A. Effleurage. B. Petrissage. C. Tapotement. D. Friction. Answer: B. Petrissage. This question assesses your knowledge of fundamental massage strokes, specifically petrissage. The keywords lifting, squeezing, and kneading are direct descriptors of this technique. Petrissage involves compressing and releasing tissues, which helps to milk metabolic waste from muscles, increase local circulation, and stretch muscle fibers. For instance, kneading a tight trapezius muscle to improve its flexibility and reduce tension is a classic application of petrissage. Remember that petrissage is excellent for deep tissue work and muscle relaxation. Question 2. A client presents with a red, swollen, and warm area on their calf, reporting localized pain. What is the most appropriate action for the massage therapist? A. Apply deep friction to the area to break up adhesions. B. Perform light effleurage distal to the area to reduce swelling. C. Avoid the area and refer the client to a healthcare professional immediately. D. Apply cold hydrotherapy directly to the inflamed area. Answer: C. Avoid the area and refer the client to a healthcare professional immediately. This question tests your understanding of contraindications and when to refer a client to medical care. The symptoms described, red, swollen, warm, and painful, are classic signs of inflammation or potentially a more serious condition like deep vein thrombosis, DVT, which is an absolute contraindication for massage. Applying massage to such an area could worsen the condition or dislodge a clot. Therefore, the safest and most professional action is to avoid the affected area entirely and advise the client to seek medical evaluation promptly. Always prioritize client safety by recognizing red flags and knowing when to refer. Question 3. What is the primary purpose of client intake forms and health history questionnaires? A. To collect contact information for marketing purposes. B. To determine the client's preferred massage pressure. C. To identify contraindications, set goals, and tailor the massage plan. D. To confirm the client has health insurance coverage. Answer: C. To identify contraindications, set goals, and tailor the massage plan. This question focuses on the essential role of initial client assessment. The phrase primary purpose indicates you should consider the most critical function of these forms. Intake forms are vital tools for gathering comprehensive information about a client's health, medical history, medications, and reasons for seeking massage, allowing the therapist to identify any potential contraindications, understand the client's needs, and customize a safe and effective treatment plan. For example, knowing a client has high blood pressure might lead you to avoid very deep work or specific areas. Thorough intake ensures client safety and contributes to effective treatment outcomes. Question 4. Which anatomical plane divides the body into anterior and posterior, front and back, portions? A. Transverse plane. B. Sagittal plane. C. Frontal, coronal, plane. D. Oblique plane. Answer: C. Frontal, coronal, plane. This question assesses your foundational anatomical knowledge, specifically the planes of the body. The keyword anterior and posterior directly points to the frontal plane. This plane, also known as the coronal plane, runs vertically and divides the body into front and back sections. For instance, thinking about a doorway, walking through it is similar to passing through a frontal plane. Mastering anatomical planes is crucial for accurately describing body movements and locations in a professional setting. Question 5. The ethical principle that requires a massage therapist to protect a client's personal health information and discussions is known as A. Professionalism. B. confidentiality. C. Informed consent. D. Scope of practice. Answer B. Confidentiality. This question tests your understanding of ethical conduct in massage therapy. The phrase "protect a client's personal health information and discussions" is the defining characteristic of confidentiality. This ethical principle means that anything a client shares, or any information gained during a session, must be kept private and not disclosed to others without explicit permission, except when legally required. For example, discussing a client's medical history with another client would be a serious breach of confidentiality. Maintaining strict confidentiality builds trust and is a cornerstone of professional integrity. Question 6. A client reports experiencing pain and numbness radiating down their arm. What is the most appropriate action for the massage therapist to take regarding the neck and shoulder area? A. Apply vigorous deep tissue massage to the neck muscles. B. Perform passive stretching of the affected arm. C. Avoid direct work on the area and recommend the client consult a physician for diagnosis. D. Use hot packs directly on the neck to relax the muscles. Answer C. Avoid direct work on the area and recommend the client consult a physician for diagnosis. This question evaluates your critical thinking regarding client symptoms and professional boundaries. Pain and numbness radiating down an arm could indicate nerve compression or other serious conditions requiring medical diagnosis, not just massage. As massage therapists, our scope of practice does not include diagnosing medical conditions. Therefore, it is crucial to avoid potentially aggravating the issue and to immediately refer the client to a medical doctor for proper evaluation. Always remember that unexplained radiating pain is a red flag that warrants a medical referral. Question 7. Which of the following is an example of an absolute contraindication for massage? A. Localized muscle soreness. B. A recent sprain, acute stage, within 72 hours. C. Chronic low back pain. D. Mild anxiety. Answer B. A recent sprain, acute stage, within 72 hours. This question assesses your knowledge of contraindications, specifically distinguishing between absolute contraindications and conditions that may be addressed with modified techniques. An absolute contraindication means massage should not be performed at all, or at least not on the affected area, due to the risk of harm. A recent sprain in its acute stage, usually within the first 48 to 72 hours, involves inflammation and tissue damage, and massage could worsen the injury or increase swelling. For example, massaging an acutely sprained ankle could delay healing and increase pain. Always remember that acute injuries require medical evaluation and rest before massage can be safely considered. Question 8. What is the most important reason for a massage therapist to practice good body mechanics? A. To increase the intensity of the massage strokes. B. To ensure the client is comfortable on the massage table. C. To prevent injury to the therapist and prolong their career. D. To improve the aesthetic appeal of the massage session. Answer C. To prevent injury to the therapist and prolong their career. This question highlights the critical importance of self-care for the massage therapist. The phrase "most important reason" directs you to the core benefit. Practicing good body mechanics, like maintaining a neutral spine, using your body weight, and moving from your core, is essential to prevent repetitive strain injuries and reduce fatigue. For example, bending at the knees instead of the waist when adjusting the table protects your back. Prioritizing your own body mechanics is vital for a sustainable and healthy career in massage therapy. Question 9. Which anatomical structure connects muscle to bone? A. Ligament. B. Tendon. C. Cartilage. D. Bursa. Answer B. Tendon. This question tests basic anatomical terminology. The phrase connects muscle to bone is the defining function of a tendon. Tendons are strong, fibrous connective tissues that transmit the force generated by muscle contractions to the bones, allowing for movement. For example, your Achilles tendon connects your calf muscles to your heel bone, enabling you to push off the ground. Understanding the roles of these key structures is fundamental for effective massage therapy. Question 10. When should a massage therapist obtain informed consent from a client? A. After the massage session is completed. B. Only if the client asks about it. C. Before initiating any massage therapy treatment. D. When introducing a new product during the massage. Answer: C. Before initiating any massage therapy treatment. This question emphasizes the crucial legal and ethical requirement of informed consent. Before initiating any massage therapy treatment is the correct timing because consent must be given knowingly and voluntarily for the proposed treatment. Informed consent means the client understands the nature of the massage, its purpose, potential risks, benefits, and alternative options, and agrees to proceed. For instance, before a deep tissue massage, you'd explain what it entails and get the client's permission. Always secure informed consent to ensure client autonomy and uphold professional standards. Question 11. Which of the following describes the physiological effect of effleurage on the circulatory system? A. Increases deep muscle spasm. B. Decreases local blood flow. C. Enhances venous and lymphatic return. D. Stimulates nerve endings, causing muscle contraction. Answer: C. Enhances venous and lymphatic return. This question tests your understanding of the physiological effects of specific massage techniques. Effleurage, characterized by long, gliding strokes, is particularly effective for promoting fluid movement. Its light, rhythmical pressure in the direction of the heart helps to milk blood through the veins and move lymph fluid, thereby reducing edema and improving circulation. For example, using effleurage on a client's leg after an injury, once swelling has stabilized, can help reduce fluid buildup. Remember that effleurage is excellent for warming tissues and aiding fluid drainage. Question 12. If a client experiences an adverse reaction during a massage session, such as dizziness or nausea, what is the therapist's immediate priority? A. Continue the massage to help them relax. B. Document the incident in detail immediately after the session. C. Stop the massage, assist the client to a safe position, and assess their condition. D. Offer them a glass of water and resume the massage shortly. Answer: C. Stop the massage, assist the client to a safe position, and assess their condition. This question evaluates your immediate response to a client emergency or adverse reaction. The immediate priority is always client safety and well-being. If a client feels unwell, the massage must be stopped to prevent further distress or injury, and the therapist must help them to a secure position, like sitting up or lying down safely, and check their symptoms. For instance, if a client suddenly feels lightheaded, you would help them sit up slowly, offer support, and ask how they are feeling. Always prioritize client safety above all else, and be prepared to act quickly and calmly in such situations. Question 13. Which muscle group is primarily responsible for extending the knee joint? A. Hamstrings. B. Quadriceps. C. Gastrocnemius. D. Adductors. Answer: B. Quadriceps. This question tests your knowledge of major muscle groups and their actions. The key action here is extending the knee joint, which means straightening the leg at the knee. The quadriceps femoris, commonly known as the quads, is a group of 4 muscles on the anterior, front, thigh that collectively perform knee extension. For example, kicking a ball involves a powerful contraction of the quadriceps. Understanding muscle actions is crucial for effective treatment planning and assessment. Question 14. What is the appropriate way to address a client's modesty and privacy during a massage session? A. Leave the room while the client undresses and dresses, ensuring proper draping throughout the session. B. Remain in the room, but turn your back while the client undresses. C. Ask the client to undress completely before you enter the room. D. Instruct the client to keep their undergarments on at all times. Answer: A. Leave the room while the client undresses and dresses, ensuring proper draping throughout the session. This question addresses professional conduct related to client privacy and draping protocols. Ensuring client modesty means providing them with a private space to undress and dress without observation. Leaving the room before and after the session allows the client to prepare comfortably, and then consistently using proper draping techniques ensures only the area being worked on is exposed during the massage. For instance, before a client gets on the table, you would step out and allow them privacy, then re-enter when they are ready and draped. Always uphold client dignity and privacy through diligent draping and professional protocols. Question 15. The effects of massage that reduce stress and promote relaxation are primarily mediated by which branch of the nervous system? A. Somatic nervous system. B. Sympathetic nervous system. C. Central nervous system. D. Parasympathetic nervous system. Answer: D. Parasympathetic nervous system. This question assesses your understanding of the nervous system's response to massage. The keywords reduce stress and promote relaxation are classic indicators of the parasympathetic nervous system's activation. This branch of the autonomic nervous system is responsible for the rest and digest response, slowing heart rate, lowering blood pressure, and increasing digestion, all contributing to a relaxed state. For example, after a relaxing massage, clients often feel sleepy or calm, which is a direct result of parasympathetic dominance. Understanding this effect helps explain how massage benefits overall well-being. Question 16. What is the purpose of documenting client sessions using SOAP notes? A. To fulfill insurance company requirements only. B. To track progress, ensure continuity of care, and for legal protection. C. To provide a summary for the client to take home. D. To determine the client's eligibility for future discounts. Answer: B. To track progress, ensure continuity of care, and for legal protection. This question highlights the multifaceted importance of professional documentation. SOAP notes, subjective, objective, assessment, plan, are a standardized method for recording client information. They allow therapists to track a client's condition and response to treatment over time, ensure consistent care if multiple therapists are involved, and serve as crucial legal documentation of the services provided. For instance, noting a client's improved range of motion in their objective section helps you track their progress. Always maintain detailed and accurate records. They are indispensable for both client care and your professional protection. Question 17. Which massage technique uses rapid, rhythmic striking or tapping motions? A. Effleurage. B. Petrissage. C. Tapotement, percussion. D. Friction. Answer: C. Tapotement, percussion. This question tests your knowledge of specific massage techniques. The keywords rapid, rhythmic striking, or tapping motions are the definitive description of tapotement, also known as percussion. This technique includes movements like cupping, hacking, and slapping, often used to stimulate nerve endings, invigorate tissues, or loosen phlegm in respiratory conditions. For example, using cupping over the lungs can help clear congestion. Remember that tapotement is generally stimulating and invigorating. Question 18. If a client expresses discomfort during a massage session, What is the most appropriate response? A. Ignore their comment and continue the stroke to work through the knot. B. Immediately stop the stroke, adjust pressure or technique, and ask for feedback. C. Tell them the discomfort is normal and will pass. D. Recommend they take a pain reliever after the session. Answer B. Immediately stop the stroke, adjust pressure or technique, and ask for feedback. This question assesses your client communication and adaptation skills during a session. The phrase "most appropriate response" emphasizes the need for client-centered care. When a client expresses discomfort, it is crucial to stop the current technique, communicate with them to understand the nature of the discomfort, and adjust your approach, e.g., lessen pressure, change direction, to ensure their comfort and safety. For example, if a client flinches, immediately lighten your pressure and ask, "Is this pressure okay, or would you prefer less?" Always prioritize open communication and client comfort to build trust and ensure an effective session. Question 19. A client reports a new, unexplained lump in their armpit. What is the most responsible action for the massage therapist? A. Massage the lump gently to assess its texture. B. Suggest the client ignore it if it's not painful. C. Refer the client to a medical doctor for evaluation and postpone massage in that area. D. Apply heat to the area to see if the lump reduces in size. Answer C. Refer the client to a medical doctor for evaluation and postpone massage in that area. This question tests your awareness of red flag symptoms and when to refer to a healthcare professional. A new, unexplained lump could indicate a serious medical condition, such as an infection, cyst, or tumor, which is outside the massage therapist's scope of practice to diagnose or treat. The most responsible action is to avoid the area and insist the client get a proper medical diagnosis before any massage on or near the lump. Always remember to refer out for unexplained lumps, rashes, or pain, prioritizing client safety above all else. Question 20. Proper hand washing is essential for massage therapists primarily to A. Remove massage oils and lotions from hands. B. Comply with aesthetic standards. C. Prevent the spread of infection between clients and therapist. D. Keep hands soft and moisturized. Answer C. Prevent the spread of infection between clients and therapist. This question focuses on fundamental hygiene and sanitation practices. The term essential highlights the critical importance of hand washing in a clinical setting. Hand washing with soap and water or using an alcohol-based sanitizer significantly reduces the transmission of bacteria, viruses, and other pathogens, thereby protecting both the client and the therapist from potential infections. For example, washing your hands thoroughly before and after each client session breaks the chain of infection. Always make diligent hand hygiene a cornerstone of your professional practice. Question 21. Which type of joint allows for the greatest range of motion, such as in the shoulder or hip? A. Hinge joint. B. Pivot joint. C. Ball and socket joint. D. Saddle joint. Answer C. Ball and socket joint. This question tests your knowledge of joint types and their associated movements. The phrase "greatest range of motion" is the key indicator for a ball and socket joint. These joints, like the glenohumeral, shoulder, joint and the hip joint, allow for movement in multiple planes, including flexion, extension, abduction, adduction, circumduction, and rotation. For instance, being able to swing your arm in a full circle is due to the ball and socket structure of your shoulder. Understanding joint mechanics helps you work effectively with musculoskeletal limitations. Question 22. What is the term for the broad, flat sheet of fibrous connective tissue that often attaches muscles to other muscles or bones? A. Ligament. B. Tendon. C. aponeuroses. D. Fascia. Answer: C. Aponeuroses. This question assesses your anatomical terminology, specifically regarding connective tissues. The description: broad, flat sheet of fibrous connective tissue that connects muscles, or muscle to bone, precisely defines an aponeurosis. While tendons are cord-like, aponeuroses are sheet-like. For example, the abdominal muscles are connected in the midline by the rectus sheath, which is an aponeurosis. Knowing these distinctions helps in understanding complex muscle attachments. Question 23. During a massage, a client begins to shiver. What is the most appropriate initial action for the therapist? A. Ask if they are cold and offer an additional blanket or adjust the room temperature. B. Continue the massage, as shivering is a common relaxation response. C. Increase the massage pressure to generate more warmth. D. Turn on a fan to circulate the air. Answer: A. Ask if they are cold and offer an additional blanket or adjust the room temperature. This question assesses your attentiveness to client comfort and ability to respond appropriately. Shivering is typically a sign that a client is cold. The most appropriate initial action is to communicate with the client to confirm their discomfort and then address it directly by offering warmth or adjusting the environment. For example, you might ask, "Are you feeling cold? I can get you another blanket." Always prioritize client comfort and communication throughout the session. Question 24. Which of the following best describes the principle of scope of practice for a massage therapist? A. The types of clients a therapist is allowed to treat based on personal preference. B. The legal and ethical boundaries defining the services a therapist is qualified and licensed to provide. C. The range of techniques a therapist has learned in their initial training. D. The physical area within a massage clinic where a therapist is permitted to work. Answer: B. The legal and ethical boundaries defining the services a therapist is qualified and licensed to provide. This question tests your understanding of a fundamental professional concept, scope of practice. This principle delineates what a massage therapist is legally permitted to do, based on their education, training, and licensure, ensuring they do not perform actions reserved for other healthcare professionals. For example, diagnosing medical conditions or prescribing medications falls outside a massage therapist's scope of practice. Understanding and adhering to your scope of practice is crucial for legal compliance, ethical conduct, and client safety. Question 25. Which term describes the application of sustained pressure to a specific point of tension or trigger point in a muscle? A. Effleurage. B. Petrissage. C. Ischemic compression. D. Tapotement. Answer: C. Ischemic compression. This question focuses on a specific technique used for addressing localized muscle tension. The phrase "sustained pressure to a specific point of tension or trigger point" accurately describes ischemic compression. This technique involves applying consistent, non-gliding pressure to a hyperirritable spot within a muscle, often leading to a temporary reduction in blood flow, followed by a rush of blood and relaxation of the trigger point upon release. For example, pressing on a knot in the upper trapezius until it softens is an application of ischemic compression. This technique is highly effective for releasing trigger points and reducing referred pain.